Hello, Gold viewers. I'm Fiona Lang-Sharp, IBCLC and Public Relations Manager and MC for Gold Lactation Online Conference 2015. Welcome to my interview with Diane Wiessinger, the Safe Sleep 7 Middle Ground for Safe Sleep, or Safe Infant Sleep, excuse me. Please welcome Diane. So Diane, so grateful for you to be here today, and I'm excited to ask you these. I've got some questions for you. I'm excited to hear your presentation. How are you doing today?
I'm doing very well, thank you. I'm glad to be here.
So here we go. I've got these top questions for you. Why are you so passionate about Safe Sleep 7 for babies?
There have been a lot of very strong, very clear campaigns about the dangers of bed sharing. The people who behind these campaigns are not at all clear on why they're saying it. The research is very muddy, and as a result, the mothers are not clear on why they're not supposed to do it. And in fact, it's something that mothers and babies have done for eons. There are safe ways to do it, and mothers simply need guidance on what is safe, what isn't, and why.
Yeah, there really seems to be a lot of really mixed messages out there, and it really concerns me because sometimes I feel at a loss as a healthcare provider. So, with all those mixed messages for families out there, how do we as healthcare providers present this information well to those families?
It's a matter of sifting through the research, which we've done in the book, and having some way to inform mothers clearly on what their risk factors are and what their risk factors aren't. And we're hoping, again, that the Safe Sleep 7 can provide that both for the mothers and for the healthcare workers who are explaining these things to mothers.
Sure, sure. Well, I tell you, I'm so appreciative. You've put a lot of work into this. And so as a healthcare provider myself, it really eliminates a lot of the stress for me because I know that I have a resource that I can look into. But what I would like to know, what are you hoping to see in the future with all this evidence that we have now and with the Safe Sleep 7?
I am hoping that it can become the middle ground between those people who have deep, deep concerns about the safety of any bed sharing and those who have a deep, deep conviction that bed sharing is what mothers and babies do. This provides very clear guidelines that I'm hoping the healthcare professional will fall on with relief and the mother will fall on with relief. It's clear, it's concrete, and that's been missing from the discussion so far.
Absolutely. And it is, of course, sleeping with your baby is one of the hot topics. Infant sleep has been talked about as long as I can remember. And there's always been such a gap between the families and the healthcare providers on what really, we need to do. So I too, like you, I'm hoping that we can all come together and find that middle ground so we can work together because we know that our mothers, of course, at some point are often sleeping with their babies, correct?
Exactly. Yes, it does happen. The question is, what do we do about that?
Excellent. Well, I think we'll leave it there because I know I'm excited to hear your full presentation, as our viewers will be as well. So thank you again for sitting down with me today and talking about the Safe Sleep 7, the middle ground for safe infant sleep. And this has been Fiona Lang-Sharp and Diane Wiessinger. Thanks everyone for listening today. Bye-bye for now.